So today, we're going to talk about a mineral most of us have heard of, magnesium. But we're going to look at it in a totally different context, one where it's literally a matter of life and death. The delivery room. Turns out, this simple element has a surprisingly powerful and kind of complex role to play in childbirth. Okay, so let's just jump right in with the question that might sound a little random. What on earth do Epsom salts, the stuff you throw in the bathtub for sore muscles, have to do with saving lives during labor? Well, believe it or not, the connection is direct, and it's pretty fascinating. The secret is magnesium sulfate. Now, chemically speaking, it's the exact same thing as Epsom salts, but in a hospital setting, it's a whole different ballgame. We're talking about a powerful, high-alert medication that's given through an IV. This isn't for a relaxing soak. It's a serious intervention for life-threatening problems. All right, so let's break down its first big job. For this one, I want you to think of magnesium sulfate as a bodyguard, a powerful shield that protects a mom from one of the most dangerous things that can happen during pregnancy. And that dangerous thing is called preeclampsia. It's a condition where a pregnant person's blood pressure gets dangerously high. If it's not controlled, it can spiral into something even worse: seizures. That's a full-blown medical emergency called eclampsia, and it's life-threatening for both mom and baby. And that is where magnesium steps in. And how well does it work? Amazingly well. There was a huge study called the MAGPIE trial. We're talking over 10,000 women, and it found that giving magnesium sulfate cuts the risk of those seizures by more than half. I mean, that's not just a small improvement. That is a massive life-saving game changer. So, what's it like to get this treatment? Well, it's pretty intense. It starts with what they call a loading dose, where they push a big amount into your IV over about 20 minutes. After that initial blast, it's followed by a slow, steady maintenance dose that drips in continuously, sometimes for a full 24 hours after the baby's even born. It's all about keeping that protective shield up during the riskiest period. Okay, so that's job number one, a powerful seizure stopper for the mom. But magnesium is a multitasker. It has a second, totally different, but just as critical identity. It's also a guardian for the absolute most vulnerable babies. So for babies who are born really, really early, we're talking before 30 weeks gestation, magnesium sulfate does something incredible. When it's given to the mom before delivery, it actually protects the baby's brain, significantly lowering their risk of developing cerebral palsy later on. It's amazing stuff. But here's the thing. Timing is critical. Ideally, you want to get the infusion going for a few hours, but the most important rule is this. You never, ever delay a delivery that needs to happen urgently just to finish the dose. The evidence is clear that even a little bit of time on the magnesium infusion can make a real difference. Some is always better than none. So we've covered the two amazing, life-saving reasons to use it. But what does it actually feel like to be on the receiving end of this stuff? Let's connect the clinical science with the real and really intense human experience. I mean, this quote just says it all, doesn't it? That first big loading dose, patients often say it's like a wave of fire washing through your entire body. It's so sudden and so overwhelming that, yeah, as this person says, it can make you throw up. It is a deeply physical, visceral feeling. And it's not just that feeling of heat. It affects your brain, too. A lot of women say they feel totally loopy, out of it, or as this patient so perfectly puts it, drunk on mag. You can feel disconnected and fuzzy, which is a really weird feeling to have during one of the most important moments of your life. And this quote right here from a healthcare worker just nails the central conflict. They even have a slang term for it, being magged out. They know how awful it feels for their patients, but they also know why they're doing it. The quote is so blunt and so true. Mag feels like shit, but it helps avoid catastrophic health problems. And that brings us to the most critical part of this whole story. Using a drug this powerful isn't simple. It's a constant, high-stakes balancing act that doctors and nurses have to manage perfectly. Just look at this table for a second. That sweet spot, the therapeutic range where the drug is doing its job, is between 5 and 9. But look what happens right after that. Get just a little bit above 9 and you start to lose your reflexes. Creep up to 12 and you can stop breathing. The line between helpful and harmful is razor thin. So you've got these two sides of the same coin. On one side, these incredible, life-saving benefits. No seizures, protected baby brains. But on the other side, if that level gets just a tiny bit too high, you're looking at really dangerous, toxic effects. This is exactly why the care has to be so meticulous. So how do they walk that tightrope? With non-stop, hands-on monitoring. Nurses are in there constantly. They're doing things like tapping your knee with a little hammer to check your reflexes. They're counting your breaths per minute. They're measuring how much you're peeing every single hour because your kidneys are what clear the drug out. It's an incredibly intensive watch to keep you in that narrow, safe zone. Which really leaves us with this one big, important question. We have this drug that is, without a doubt, a hero. It saves moms and protects babies. But that heroism comes with a serious cost to the patient's experience, making them feel sick, hot, and out of it. And so the real challenge isn't just about giving the medicine, it's about how we support the person who has to go through the awful experience of being magged out in order to save a life.